Medical emergencies, seizure control. What is an epileptic seizure? A seizure occurs as a result of a sudden discharge of electrical energy somewhere in the central nervous system and caused by an imbalance among the neurons of the brain. The majority of cases, the cause is unknown. It could be caused from injury during birth, a fall or a car accident, a severe infection, or a high fever. There are different types of seizures. The first is a grand mal or a tonic-clonic. It is the most common. Tonic-clonic refers to body movement, that involuntary muscle spasms. Often the patient will feel an aura or sight, sound, or smell just before the onset of the seizure. There are different phases of these seizures: prodromal, convulsive, and postical. Prodromal. This happens before the seizure. Personality might change, that aura, that sight, sound, or smell difference, numbness and tingling. Convulsive. The tonic-clonic state. The patient will lose consciousness. There may be an epileptic cry from the air rushing out of the lungs. The body stiffens and jerks violently. There may be foaming at the mouth and loss of bladder and sphincter muscles. Postical. The seizure is over. The patient begins to regain consciousness and they may be confused. Often the patient will be tired and need to sleep. Absent seizures. These are also known as petit mals. There might be just a blank stare, a twitch, or a rapid blinking. It's most often seen in children and can often be misdiagnosed as a behavioral problem for those in school. It can occur 100 times a day of very short duration. A partial seizure involves only one hemisphere of the brain. One body part begins with jerking movements. There can also be a trance-like state or fidgetiness. Status epilepticus. This is the most dangerous. 10% of these cases result in death. It is a continuous seizure that does not end. Treatments. Stop all dental treatment. Remove objects that may injure the patient, especially objects that are in the mouth. Remove their eyeglasses and loosen their clothing. Call the emergency medical system. Do not restrain the patient. Place the patient on one side once the seizure is over, and reassure the patient. Do not give the patient anything to eat or drink. Let the patient recover on their own time. Dilantin gingival hyperplasia. Dilantin is the medication that is often given to patients who suffer from seizures, but the side effects of this cause an overgrowth of the gum tissue. Often this is surgically removed. Sometimes the teeth can fracture, or we see wear on the cusps. We call that bruxism, that grinding and clenching. And there can also be scarring of the lips or the tongue. Prevention. Again, that Dilantin is the anticonvulsant medication that's prescribed. If it happened before, what triggered it? Was it a smell? Try not to keep your patient waiting or under stress.